Hello everyone, this is Dr. Ritika Mani, Dolphin Institute of Biomedical and Natural Sciences from Physiotherapy Department. Let us discuss about the topic Proprioceptive Neuromuscular Facilitation. What is there in this? Proprioceptive, having to do with any of the sensory receptors that give information concerning movement and position of the body. Pnf, also called as Pnf, it is a movement therapy which rely mainly on the stimulation of proprioceptors for increasing the demand made on the neuromuscular mechanism to obtain and facilitate the response. Now, what is the neuromuscular system? Involving nerves and the muscles. And what is facilitation? Making the movement easier. Next is the proprioceptive neuromuscular facilitation is the exercise based on the principle of functional human anatomy and neurophysiology. It uses our proprioceptive system, the cutaneous receptors, the auditory input to produce the functional improvement in motor output and can be a vital element in the rehabilitation process of the sports related injuries. Now, what are the neurophysiological bases of the PNF? As PNF derives its theoretical basis on Sherrington's statement. Inputs from the peripheral nerves and receptors affect the excitability of the alpha motor neurons. It includes the concepts of facilitation and inhibition, the stretch reflex, and the neurophysiological phenomena. Moreover, the alpha motor neurons are also under the influence of cerebral cortex. Thus, it is theoretically possible to modify the excitability of alpha motor neurons through peripheral inputs in such a way that the influence of the central mechanism are reduced or uncased. Now, what is there in the facilitation? Facilitatory, an impulse that causing the recruitment and the discharge of the additional motor neurons in the spinal cord. It results in increased the excitability in the muscles. Mainly the weak muscles would be aided through facilitation. What is there in the inhibition? Any stimulus that causes the motor neurons to drop away from the discharge zone and away from the spinal cord. Inhibition results into the decreased excitability of the motor neurons. Muscle spasticity can also be decreased. Now, what is there in the stretch reflex? The stretch reflex involves the two types of the receptors. Includes the muscle spindles, the Golgi tendon organs. Now, let us discuss about the uses of the PNF. The PNF treatment has been used to increase strength, flexibility, coordination, and the functional mobility. The main goal of the treatment is to facilitate the patient in achieving the movement or posture. Stretches as well as diagonal and the rational exercise patterns are used to improve the ADL functional abilities and the athletic performance. It is mainly used in the orthopedic rehabilitation for musculoskeletal injuries and in the neurological rehab also. PNF can be used for any condition, however, the patient condition level may require modification. It is defined as the movement therapy for promoting the response of neurons, musculoskeletal and respiratory mechanisms by stimulating the proprioceptors using the principle of reciprocal innervation, stretch reflex, summation of stimulus, etc. Basically, we have two types of PNF. That is the classical PNF and the modified PNF. Now, what are the basic principles of PNF? First one is the resistance. Second is the irradiation and reinforcement. Third is the manual contact. Fourth is the stretch. Fifth one is the verbal commands. Sixth is the traction and approximation. Then next is the timing and the body positioning and the body mechanics. All are there in the principles of PNF. First one is the resistance. That is the opposing force to the patient movement is called resistance. The amount of resistance provided during an activity must be correct for the patient condition and the goal of the activity. This is called as optimal resistance. Now, resistance is used in the treatment mainly to facilitate the ability of the muscle to contract, increase the motor abilities, help the patient to gain awareness of the motion and its direction, and also increases the strength. Next is the irradiation and the reinforcement process. Irradiation is the spread of the response to stimulation, and the reinforcement means to strengthen by the fresh addition, which makes the muscle more stronger. What are the effects of irradiation? Maximal resistance may be used to cause irradiation or overflow from the stronger patterns to weaker patterns, or from the stronger group of the muscle within the pattern to weaker group within the same pattern. There is a spread of the impulses of energy from a strong muscle groups to the weak muscle, especially when the stronger muscle works against a very high resistance. The weaker muscles are benefited by this. It should be avoided in the spastic cases. Next is the manual contact. What are the effects of the manual contact? It stimulates the muscle, stimulates the synergistic muscles to reinforce the movement, promote the trunk stabilization and directly help the limb motion, and it prevent the confusion process. It is necessary to facilitate and guide the movement. It should be maintained without discontinuity. Specific manual contact like lumbrical grip, as it offers the exteroceptions, stretch, resistance and traction. It should be purposeful, directional and comfortable. Next is the touch or the manual contact. It contributes to facilitate by stimulating the exteroceptor, as I have told you, and it should be purposeful, directional and comfortable. Now, what is there in the stretch? The stretch stimulus occurs when the muscle is elongated. The strengthened position of the muscle is the static position of each pattern, and the stretch is maintained throughout the movement. All the components of the pattern must be stretched simultaneously. It facilitates the movement and increases the power of weak muscle by facilitating the proprioceptors. Now, what are the effects? It includes mainly, it stimulates the activity of the muscle spindle. Any contraction of the muscle on stretch will result in movement, and the brain knows not of the muscle but of the movements. Next is our traction. What is there in the traction? Traction is the elongation of the trunk or an extremity. Traction force is applied gradually, maintained throughout the movement and combined with the appropriate resistance. Now, what is there in the traction process? Joint suppression stimulates the joint receptors. Muscle stretch stimulates the muscle spindle stretch receptor. Facilitates the alpha motor neuron. Facilitate strength. Next one is the approximation process. Approximation is the compression of the trunk or an extremity. Compression throughout the joint stimulate joint receptors, facilitate the alpha motor neuron, and it facilitate the stability. Now, what are the uses of the approximation? It promote stabilization. It facilitate the weight bearing and contraction of the postural muscle. It facilitate the upright reaction. Resist some components of motion. Example, use approximation at the end of shoulder flexion to resist the scapula elevation. Now, next is the verbal stimulation. The volume with which the command is given affects the strength of the resulting muscle contraction. louder command when strong muscle contraction is required, and the softer and calmer tone when the goal is relaxation and the relief of the pain. What about the timings? Timing is the sequencing of the motions. Normal timing of most coordinated and the efficient motion is from the distal to proximal part. Timing for emphasis involves changing the normal sequencing of the motion to emphasize a particular muscle or desired activity. Now, body positioning and body mechanics. The therapist's body position should be in the line of motion. Shoulder and pelvis face the direction of motion. Therapist stands in walk standing position. As you all can see in the diagram, therapist is in the standing position. The resistance comes from the therapist's body while the hands and the arm stay comparatively relaxed. That's the brief about the PNF technique. Next detail we will discuss it in the next video. Thank you so much.